I'm on this quest for knowledge to get answers for both you and me. Join me as I learn more about MAC lung disease and ARIKAYCE from a researcher, a doctor, and a patient living with this disease. Let's get moving.
What is ARIKAYCE? ARIKAYCE is used in combination with multidrug therapy for adults who still test positive for MAC lung disease after at least 6 months on multidrug treatment alone. ARIKAYCE was approved by FDA using the limited population pathway. This means FDA has approved this drug for a limited and specific patient population, and studies on the drug may have only answered focused questions about its safety and effectiveness. ARIKAYCE was studied in adult patients. It is not known if ARIKAYCE is safe and effective in children younger than 18 years of age.
ARIKAYCE is associated with the risk of increased respiratory adverse reactions, including allergic inflammation of lungs, coughing up blood, severe breathing problems, and worsening of COPD. While using ARIKAYCE, these side effects may become serious enough that treatment in a hospital is needed.
Today, we're meeting with a pulmonologist in New York who's been treating MAC lung disease for over 9 years. Although she was never my doctor, she's someone I've had the pleasure of meeting a few times before this.
One of the ways that I think I help my patients the most is by telling them that I really like to take a team approach to their management of care. My entire team is available, as well as myself, to be able to assist in any questions that arise, any complications that potentially may arise, so that we can make our patients feel that even though this might be a long and complicated journey, that we have people that understand, that are informed about what they are going through, and are here to help every step of the way.
I think the whole diagnosis of MAC lung disease and NTM can be a very scary journey, especially when you're first embarking on this. And I sure wish I had known more at the beginning. That would have helped me along the process a little more quickly. I'm not even sure I could pronounce the name of it fluently the first few months. I would imagine, Dr. Lepinel, that it's sometimes challenging to measure how much a patient is really ready to hear. So in your particular practice, how do you gauge that, and how do you inform your patients so that they feel cared for and supported in this journey?
That's a wonderful question, right? Because everybody does come to the table having different backgrounds of information. Everybody has different journeys, has different awareness of their underlying disease. And you want to inform people, but you also don't want to overwhelm them, and for a concern of they may take a step back. But overall, I like to give a basic understanding of what the disease is, what the potential course may be, and that while we have different treatment approaches, it's tailored to that individual patient.
I sometimes hear from other people that they don't want to start MAC treatment right away. What do you think?
I really feel that the decision to start treatment is one that needs to be made individually. In many patients, as we've learned more about the disease, I caution them that if they are not started on treatment, that it can lead to a worsening of their underlying lung disease over time. And so to that point, I follow the NTM treatment guidelines that recommend treatment over watchful waiting. And the goal of that treatment is to test MAC negative. The guidelines do, in fact, discuss the length of treatment, and they usually mention that patients should remain on treatment for at least 12 months from the time that they first convert to culture negative. So if somebody that has been MAC positive converts to MAC negative, they must continue treatment for at least 12 months from that point. We want to do everything that we can to help treat it and clear it and prevent it from coming back.
When you say MAC lung disease is difficult to treat, like it was for me, you probably have other patients that it's the same.
And that's why for my patients that I do decide to start on treatment, when we discuss the oral antibiotic regimen that we're putting them on, I actually bring up ARIKAYCE early on in their diagnosis. We're going to follow the guidelines and treat with proven therapies. So the addition of ARIKAYCE is strongly recommended for patients that continue to test positive after 6 months of treatment. These are points that are really important to know. And so I really encourage patients to speak with their physicians when they're embarking on their treatment journey.
So when you found out that ARIKAYCE was approved, what was your reaction?
I was very happy. There's almost a sense of relief. Now we have this drug that's FDA approved in a limited population for patients that continue to test positive after 6 months of a multi-drug treatment regimen.
I think a lot of patients want to know, what are the chances that ARIKAYCE is going to work for me?
When patients ask me that, I like to refer them to the data from the study for which ARIKAYCE gained, its FDA approval. So let's head inside to my office so we can review some of the clinical data so I can answer your question a little bit more clearly.
Thank you. I'd like that. It was so interesting to meet Dr. Lapinall and to hear about her range of experience.
Many patients just wanted to know what we could experience on this journey. It was refreshing to hear doctors also find this disease frustrating. After all, we're in this together. Let's see what we can learn at our next stop.
Important safety information and boxed warning. ARIKAYCE can cause serious side effects, including allergic inflammation of the lungs. These respiratory problems may be symptoms of allergic inflammation of the lungs and often come with fever, wheezing, coughing, shortness of breath, and fast breathing. Coughing up of blood, 𝗕𝗢𝗫𝗘𝗧𝗬. Coughing up blood is a serious and common side effect of ARIKAYCE. Severe breathing problems. Severe breathing problems can be symptoms of bronchospasm. Bronchospasm is a serious and common side effect of ARIKAYCE. Bronchospasm symptoms include shortness of breath, difficult or labored breathing, wheezing, and coughing or chest tightness. Worsening of chronic obstructive pulmonary disease, COPD. This is a serious and common side effect of ARIKAYCE. Serious allergic reactions. Serious allergic reactions that may lead to death have happened to people who take ARIKAYCE. Stop taking ARIKAYCE right away and get emergency medical help if you have any of the following symptoms of a serious allergic reaction: hives, itching, redness or blushing of the skin, flushing, swollen lips, tongue or throat, trouble breathing or wheezing, shortness of breath, noisy, high-pitched breathing, stridor, cough, nausea, vomiting, diarrhea, feel cramps in your stomach area, fast heart rate, feeling lightheaded, feeling faint, loss of control of the bowels or bladder, incontinence, and dizziness. While using ARIKAYCE, these side effects may become serious enough that treatment in a hospital is needed. Call your healthcare provider or get medical help right away if you have any of these serious side effects while taking ARIKAYCE. Your healthcare provider may ask you to stop using ARIKAYCE for a short period of time or completely stop using ARIKAYCE. Do not use ARIKAYCE if you are allergic to any aminoglycoside or any of the ingredients in ARIKAYCE. Before using ARIKAYCE, tell your healthcare provider about all medical conditions, including if you have asthma, COPD, shortness of breath or wheezing, bronchospasm, have been told you have poor lung function, have hearing problems such as ringing in your ears or hearing loss, have dizziness or a sense of the room spinning, have kidney problems, have neuromuscular disease such as myasthenia gravis, are pregnant or plan to become pregnant. It is not known if ARIKAYCE can harm your unborn baby. ARIKAYCE is in a class of medicines that may be connected with complete deafness in babies at birth. The deafness affects both ears and cannot be changed. Are breastfeeding or plan to breastfeed. It is not known if the medicine in ARIKAYCE passes into your breast milk and if it can harm your baby. Talk to your healthcare provider about the best way to feed your baby during treatment with ARIKAYCE. Tell your healthcare provider about all the medicines you take, including prescription medicines and over-the-counter medicines, vitamins, and herbal supplements. ARIKAYCE may cause serious side effects, including hearing loss or ringing in the ears, ototoxicity. Ototoxicity is a serious and common side effect of ARIKAYCE. Tell your healthcare provider right away if you have hearing loss or you hear noises in your ears, such as ringing or hissing. Tell your healthcare provider if you start having problems with balance or dizziness, vertigo. Worsening kidney problems, nephrotoxicity. ARIKAYCE is in a class of medicines which may cause worsening kidney problems. Your healthcare provider may do a blood test to check how well your kidneys are working during your treatment with ARIKAYCE. Worsening muscle weakness, neuromuscular blockade. ARIKAYCE is in a class of medicines which can cause muscle weakness to get worse in people who already have problems with muscle weakness, myasthenia gravis. The most common side effects of ARIKAYCE include changes in voice and hoarseness, dysphonia, cough during or after a dose of ARIKAYCE, especially in the first month after starting treatment, muscle pain, sore throat, tiredness, fatigue, diarrhea, nausea, headache, fever, decreased weight, vomiting, rash, increased sputum, or chest discomfort. These are not all of the possible side effects of ARIKAYCE. Call your doctor or pharmacist for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. What is ARIKAYCE?
ARIKAYCE is used in combination with multidrug therapy for adults who still test positive for MAC lung disease after at least 6 months on multidrug treatment alone. ARIKAYCE was approved by FDA using the limited population pathway. This means FDA has approved this drug for a limited and specific patient population, and studies on the drug may have only answered focused questions about its safety and effectiveness. ARIKAYCE was studied in adult patients. It is not known if ARIKAYCE is safe and effective in children younger than 18 years of age.
Please see full prescribing information at ARIKAYCE.com.